Hey, friends. Good morning, good afternoon, good evening. Wherever you are watching this video from, welcome to Dr. Ajay Vibes. Another homeopathic episode. We will cover another excellent everyday usage homeopathic medicine, Belladonna. That is the medicine we are discussing today. It comes from a family called Solanaceae or Solanaceae, depends on which part of the world you are located, otherwise known as deadly nightshade. Deadly nightshade. So let's take a very quick look at what sort of specific characteristic symptomatology belladonna covers. The proving belladonna was proved on healthy human beings. This is the symptomatology drawn from provings, right? People are bilious nature. Bilious means, you have gallbladder, bile. Now that sort of area is more active, more bile secretion, right? It's called bilious nature. Those sort of symptomatology come from that sort of picture, digestive symptoms, etc. Right? Lymphatic. This lymphatic system we have in the body, just like the circulatory system, blood vessels, we have lymph nodes and lymphatics all around the body, right? That circulate lymph fluid, right? We will go into more into that when it is the right time. Plethoric means excessive blood circulation as well, particularly to the upper area of our body, our head and face and eyes. You will see those symptomatology a lot in belladonna as we cover quickly today, right? Plethoric, so bilious, lymphatic, plethoric, lovely and entertaining people. They are usually, right, in homeopathy we observe the nature of the person. They are very lovely people, entertaining people. If you are in their company, you are well entertained, right? This is how we observe homeopathy. When a person comes into the clinic room or a hospital setting, a practitioner is observing all this stuff without even asking anything, asking you or whoever accompanying persons, right? So very lovely and entertaining, but violent and delirious when sick. If something goes wrong with their economy, their body, their mind, their health, something is going on, they become very violent and delirious. Delirium is an altered state of mind, right? I'm sure you heard it, delirium, or you may have experience with the elderly people in the family, right? I have those experiences from my childhood days. I used to watch, right? I'm sure you are same. So when you look at women and children, they are light hair, very light, thin hair. Some other people you can observe in children or women, very light hair, right? Blue eyes are bluish. You can see that, right? Very fine complexion, very fine, right? Delicate skin. All our skin is very delicate, right? We'll go into more details shortly. These people are threatened with convulsions, particularly children. If they have a slight temperature, very mild, seasonal, cold and fever, etc., the fever is a little higher end, they develop convulsions. They are called febrile convulsions. Convulsions means fits. Everybody knows fits, right? It's a febrile nature, means it's coming from just slightly high temperature. Takes cold easily. Belladonna constitution, belladonna person, they get cold easily, right? From draft of air, a slight draft of air, developing cold. Uncovering the head is uncovered, open air, you develop cold. These are the common things we see in Belladonna picture, symptomatology. Haircut, if somebody got a haircut, comes out from barber shop, a slight wind, they develop cold. A dose of Belladonna will clear it away. But again, friends, this is only for educational and awareness purposes. You have to consult a qualified homeopath for proper care. Riding in a cold wind, you are on a bicycle, motor bicycle, a scooter, right? Riding against cold wind, little cold wind. You are developing Belladonna symptomatology, right? Exposure of feet. You are sleeping, but feet is out. Whatever reason, you are having feet outside or exposing your feet to little cold drafts, cold wind. You are developing this cold and respiratory symptoms. Quick sensations and motions. Very quick sensations, bodily sensations and motions, movements of right body and facial expressions. You can see in people slight wind, facial expressions, wind, bodily motions, very quick. They happen. Eyes snap. They are snapping very fast and moving eyes very fast. Look, this is the sort of observation you need in homeopathy, my friends. Either you observe and you inform your doctor, your practitioner, homeopath. And some of these symptoms are objective, means you are just there in your presence. A practitioner can observe. Practitioners, homeopaths are very well trained with all this sort of stuff. They can observe just like that, right? Observation is very important in homeopathy. The nature of pains, sudden. Pain strikes sudden somewhere in the body, facial muscles, neuralgia or shoulder pain or wherever, pain, abdominal pain, visceral organs, pain, sudden, just like that, pain comes, right? Loss indefinite, it's as if there is no end, it's not, it's going to last forever, it seems to. Then it ceases suddenly, means it will disappear suddenly. So they come suddenly, they last indefinitely for a long time, seems to be, but suddenly they disappear. That is the nature of pains in Belladonna. If those sort of pains in acute conditions, just a pain episode, a dose of Belladonna 30 or 200 will do magic. Rush of blood to head and face, right? Blood is flowing, circulatory, lots of circulatory and neurological disturbances you see in Belladonna symptomatology. Circulatory, particularly upper area, part of our body, head, face, right? This area, neck, these areas, more circulation, blood is rushing as if it is rushing very fast. You can observe, sit right next to your family member, your friend, your colleague. You can see, hey, the blood is rushing fast. Now, one of the characteristics of Belladonna, it looks what? Face and eyes, very red. Redness of face and eyes. They had a blood shot. They are very red, right? And it comes very sudden. Just a slight wind, a draft of wind, right? A noise. Even noise is very sensitive for Belladonna person. Even sunlight, the light on your face, suddenly rush of blood in acute conditions, right? Or acute episodes of some chronic disorder person is having, but this is the acute episode is coming up due to these environmental changes. So this sudden rush of blood to upper part of your being, your face and head and eyes and neck, this region, you observe, your practitioner observes when you are there, right? Because of this circulatory disturbance, excessive circulation, you see throbbings in brain. A person may explain to practitioner, I am feeling all this throbbing wherever I touch. It's a throbbing, mild throbbing pains, carotids, throbbing pain, throbbing. You feel the sensation of throbbing like that. We all feel that time to time, right? So that is belladonna, circulatory and neurological disturbances in acute conditions. Very small, simple problems, phases. Just a dose of belladonna, a couple of doses will clear it away. That picture, that circulatory imbalance, neurological hyperactivity, belladonna will just straight away take away. My friends, these videos are meant for everyday people, like my friends, family, extended family on YouTube. We are attracting. This is not specifically designed for medical health practitioners, homeopaths, but it helps anyone to revise the subject anyway, right? So I am trying to keep the terminology as much possible non-medical, as much as possible, right? But it's really challenging, right? We do have to use some medical terminology. So if you are finding something, I mean, this is everyday language nowadays. Everyone knows all this terminology anyway. But if you are finding anything, please Google it up, right? That's all. You will get to find a little more information about that. Because of time shortage, we can't spend too much time on these videos, unfortunately. But we will be doing these important medicines again and again. And I am doing lives. I am hoping I will do a live tomorrow, Friday. First live. I haven't checked it out yet. I didn't get a chance to do that. But I am sure I will be able to do it. If I can't do tomorrow, first live, it will be on Saturday for sure. Okay, my friends? Again, due to excessive circulatory disturbances, neurological disturbances, a person develops imaginations, all kind of imaginations, right? Sees ghost. This is all imagination, right? They are seeing ghosts. How do you say ghosts, right? Okay, hideous faces. Okay, insects. They see insects are crawling everywhere. Again, these are circulatory disturbances and neurological disturbances, as we discussed a little earlier, right? So they are seeing ghosts, hideous faces, insects, black animals. They see the black animals, some imaginary. They are running around you, around home or whatever. Dogs, wolves. But these are all what? Imaginations only. Hallucinations. Sensory perceptions, changes in sensory perceptions. Hallucinations, right? Imaginary things they are afraid of. All kind of imaginary things. We discussed imagination, right? They are afraid of them, wants to run away, right? Deliriums. Again, it's a state of mind, mood, mind disturbances, right? Deliriums, they bite. For example, somebody is sitting, they might bite you, right? They might spit at you, right? But don't take it serious, okay? It's out of delirium. It's happening. Strike. You are sleeping next to someone and you are getting a slap, a strike, right? Fits of laughter. Somebody is suddenly, all of a sudden, starts into laughter. Fits of laughter, right? Again, don't be frightened. It is just out of delirium, right? Run away. They want to. They always want to run away. Gnashes teeth. Gnashes teeth. Tries to escape. They want to escape from home or from room or get out of the bed. this is out of delirium, right? We may see that some of these picture in elderly people, right, or even children, younger children, you may see this, right? But again, please, this is educational purposes only, to let you know the scope of homeopathy. What sort of scope is there in homeopathy? Excellent scope, isn't it? It a simple medicine like Belladonna. It's very simple homeopathic Belladonna, and it covers so much physiology, pathophysiology, internal medicine, changes within your mind, sensory organs, right? Body, perceptions. A dose of Belladonna, 200. We will clear away a lot of this picture. 30. A dose or couple of doses. But again, you need to be evaluated by a homeopath, a good trained, well-trained homeopath, experienced homeopath. Someone local to you, ideally. I always encourage you, see, what I am doing is educational videos only, right? So I encourage you, if you develop understanding, some awareness from these videos, understand the scope of homeopathy, then I see if you need help, I encourage you to see a homeopath locally. Someone you can reach physically, you can go meet. That's the beauty of a consultation, right? Physically, locally. So what I am doing is just providing some awareness. Thanks to it, this beautiful platform called YouTube. That's all, my friends. Okay? So when you come to the bodily organs, head, heart, painful, very hot, right? We discussed circulatory, abnormal, excessive circulation, some neurological changes, right? Very hot and painful head, face flushed, right? We covered that. Face is flushed, red, excessive circulation. Eyes wild, staring, again, excessive circulation, right? Wherever you see in Belladonna, excessive circulation. So face is what? Flushed, eyes wild, staring, pupils dilated, pulse full. If you check someone's pulse, their pulse is full pulse, right? Because of what? Excessive circulation, hyper neurological activity. That's all there is. And organs, head, mouth, very dry mouth. They need water. Some water again. Belladonna, like I need water right now. Right? You need water. And stools, tardy. Number 2. Very little dry, tardy stool, urine suppressed. Again, circulatory disturbances, thereby disturbances in the water metabolism, water content, leading to dry stools, dry mouth, tardy stools, urine suppressed, sleepy but can't sleep. They are very sleepy, but can't sleep much. So I mentioned in the very beginning, right? Febrile convulsions, particularly during teething stage of children. Head is very hot, again, circulation, higher circulation to upper part of body, right? Head is hot, feet cold, because all the blood is rushing upwards. So feet cold, head very hot. During teething time, febrile convulsions, teeth are just coming out, little boy, baby. Febrile convulsions, slight fever, they are getting fevers. So again, headaches from slight noise, jar of motion, jar, slightly you are jarring even, is causing a headache from motion, right? Light, we said that little earlier, light, right? Lying down, even lying down or least exertion, little bit of exertion is causing what? Headache. So if you apply pressure, very tight bandage, wrapping up, you are wrapping up whole head, face, for example. that relieves the headache. These are some of the characteristics of bryonia headache. Okay, friends, if you have to re-listen, go back, listen whichever part you want to listen again. Go back to, very soon I will have chapters on these videos. I am just figuring out how to do that. Right, then you can jump to each chapter back and forth, whichever you want to listen. So if you are concerned about any particular area I mentioned so far, just go back and re-watch, re-listen to it again. Okay, my friends? Boring head into pillow, particularly little children. They have a pillow over their face. They are covering under pillow. Right? Again, in the head area, they are getting vertigo, giddiness. Right? From stooping, bending forward, stooping. Whatever reason you have to bend forward, stoop to pick up something or whatever, you are getting vertigo. Belladonna covers that beautifully. Right? After stooping, you are rising, for example. Vertigo again, giddiness. Right? Change of position. You have to change position from one place to another place, one position to another position. You are getting vertigo. These are all again circulatory disturbances, neurological disturbances, as we discussed earlier. Right? So the bodily part, as we are going down, abdomen, your tummy area, right? Tender, very tender, slight touch, painful. Abdominal area, right? Distended, abdomen is like distended. Extended abdomen, it looks bigger than what it is, right? And least jar, again, like in headache, least jar, you are slightly moving, jar. Slow steps you are taking even, you are jarring away, not even walking, is increasing what? Same way the headache, now the abdominal tenderness, that pain, uneasiness is increasing. Even off the bed sheet. You have a bed sheet, right? You are moving up and down bed sheet. You are under the bed sheet. Now that is causing the tenderness in the abdominal area. In right ileocecal area. Very important medical terminology this. It's better even you remember this, right? Right ileocecal area is called lower portion of right side of your belly, abdomen. Lower portion, right? In that area you have a thing called appendix. I'm sure you all heard it, right? Appendix, we need to be careful with appendix, right? If you are having any pain in that area, you better go and see your doctor, go to hospital, my friends. Okay? You need to be evaluated and make sure it is not something danger with appendix, right? So I have to say that in this. So is a right ileocecal area, they call it lower right side of your abdomen. If the pain, it could be appendix. Sometimes it needs to be addressed immediately, right? It could be even surgical case. But if there is slight discomfort in right ileocecal area, in that area, region, slight touch, even of the bed cover you are pulling, you are feeling right ileocecal, a little bit of discomfort, right? And of course, belladonna helps under supervision, but you have to be careful. But you know the scope of homeopathy here, right? Right, slight disturbances with the appendicular area, a mild episode, belladonna might help, but you need to be evaluated properly by a physician, and belladonna can very well help with that happening. Transverse colon protrudes like a pad. Transverse colon, there is a, if you have some understanding of your abdomen, your belly, all the intestines, there is a transverse colon shaped like this, transverse colon in the middle, upper to middle area of your belly. This transverse colon, it protrudes like a pad. It looks like a pad, it is bulging out. and it is very sensitive to touch. Slight inflammation there may be. Belladonna is very specific action in that area, right? So again, in the abdomen, pressing down as if contents of abdomen would issue from vulva. You know the vulva, right? The female organs area, as if you feel as if they are in the labor or in delivery. Now they are feeling as if everything from abdomen, belly is going to come out. Again, friends, this is not, you need to be careful, any of this stuff, right? You better consult a physician. But what I am trying to do is to let you know the scope of homeopathy. If there is that sort of sensation, if it is all safe and good, no problems much, a belladonna, a couple of doses can help, right? But you need to be evaluated by a homeopath. This is only for awareness purposes. We are discussing this. Okay, my friends? Worse in the morning hours, usually. That's how the sensation is worse in the morning. It's better either standing or sitting erect, like me, sitting erect without moving, or standing upright. It helps with that sort of sensation. They have to either sit or stand straight, right? Any other position, they feel they might come out female, right? That's what we are discussing right now. So there is another medicine called calcarea carb, which we are going to discuss very soon, okay? Calcarea carb, which is usually a follow-up medicine for belladonna. If belladonna is given very soon or at some stage, usually calcarea carb is needed. This is the observation by homeopathic fraternity, homeopathic community for centuries. Calcarea carb very nicely follows belladonna, which we are going to discuss very soon, right? So to conclude this video, I don't want to be this more than half an hour, okay, my friends? So aggravation means whatever increases problem for belladonna person. Aggravations from touch, we discussed that enough, right? Touch, motion, jar, just jarring motion, it increases. Noise, draft of air, looking at bright light or sunlight, shining objects after 3 p.m., night after midnight. Again, we discussed a few medicines, this symptom, right? You notice that in belladonna as well. So that's why in homeopathy, you don't base your prescription based on one symptom, because the symptom is covered by many medicines, right? But you look at the totality of whole picture. We covered from head to bottom. We covered some physical generals, mind generals, delusions, hallucinations, imaginations. They all come under mind picture, right? So you cover everything. If everything is matching, it doesn't have to be every symptomatology in a person, but the totality, right? They have something covered here, something covered there, something covered here. The whole aspect is pointing towards belladonna. We will go into philosophy topics. This comes under homeopathic philosophy, totality of signs and symptoms. We will discuss more of these topics so that our friends and family here on YouTube can not only understand, follow, and when they see a homeopath, they will be able to relate with them better, explain their problem better, so that they get the best help possible. All right? So all these things aggravate: touch, motion, noise, draft of air, looking at bright shining objects after 3 p.m., night after midnight, while drinking, uncovering the head. We discussed that, uncovering the head, right? Summer sun, lying down, even lying down. Problems increase for belladonna person or a patient. You may commonly hear, right? Amelioration means whatever decreases the problem for belladonna. Rest, standing or sitting erect, we just mentioned, right? Sitting erect or standing. Warm room, very nice and warm room. Belladonna will do a great job. Friends, If you haven't subscribed to this channel, you know what to do. Please subscribe to this channel. I am just starting. Monday inspirational videos, Wednesday homeopathy. I am late. Today is Thursday. But usually Wednesday, if late Thursday. But usually Wednesday. Monday inspiration, Wednesday homeopathy, Friday, which is tomorrow already. And first time I am trying tomorrow. Let's see how it goes. If any technical glitch or any problem, it will be on Saturday. I am doing my first live this week or weekend. Friends, please, I need your help. I need your subscriptions. That's how we settle down on this beautiful channel called YouTube, Dr. J Vibes channel. Let's make this channel permanent by showing your support, right? Like, share, comment on these videos. Share it with a few friends, my friends. Let them watch as well. Let's make this channel more popular, okay? And subscribe. Don't forget your personal subscription and share it with your friends and family. That way, YouTube sees, hey, there is demand for this guy, Dr. J Vibes. Let's settle this channel down. They will monetize account, okay? Then we will be permanent on this platform. We will improve even better, all right? If you have any feedback, whatever feedback you want to give, suggestions you want to give, please do put those suggestions in the comments below. What would you like to see with inspirational videos, homeopathy videos, and I will be doing lives soon. What would you like to see from my side? Friends, please subscribe, okay? See you again on live very soon. Bye for now.